Hi, this is Chrissy Reichert, and I'm here with Jared Hall, and we'll be doing our second role play video. I will be portraying the 55-year-old CrossFit athlete with dementia.
And I will be the athletic trainer that will be giving out a treatment plan for this patient.
Okay. Hi, I'm Chrissy. My coach told me that I wasn't allowed to train unless I came to see you, and I'm not particularly in agreement with what he thinks, so I guess here I am.
Okay, so what can you tell me a little bit about what's going on? Why would your coach tell you that? Obviously there's some reason that has for not allowing you to work out, but is there something going on?
He thinks that I'm either like dehydrated or malnourished or something, or maybe I'm just very forgetful, which I don't agree with because I don't remember forgetting anything. So he thinks that I might have some like a concussion or something because apparently I'm forgetting to drink and to eat, and apparently I'm doing a lot of sets over again because I've forgotten that I've done them, but I don't think that's very accurate.
Okay, did you have an injury of any sort, or have you had any kind of history of having head injuries or concussions in the past?
Not that I can remember. I mean, I think when I was a kid, like, what kid doesn't, hit their head a couple times, but I personally don't remember really having an injury. But that maybe my coach is right. Maybe I just have a bad memory.
Okay. And so tell me a little bit about kind of what you do when you go to the gym and you work out. What kinds of exercises are you doing? Are you taking some breaks? Are you getting water breaks built in there? What kind of, tell me a little bit about your pattern or your behavior there.
I feel like I go to the gym every day for an hour, and it's a CrossFit gym, and I'm a woman, so I've got to prove myself. And so I do a lot of lifting, a lot of running, a lot of burpees and push-ups and pull-ups. And I think I take adequate water breaks, but maybe I don't. Maybe that's the reason that my coach is concerned. But I work really, really, really hard, and I do it every single day, so.
Okay, what's your diet been? Over
I honestly don't. I don't remember. I don't remember. I don't know. Should I know that?
Do you have these episodes often?
Episodes of like not being able to remember to eat or like what do you mean?
Well, like right now, you just forgot what you were doing there for a second. It sounded like to me, or looked like to me.
I guess you're right. I don't. Oh, I thought I was always easily distracted. I guess I never really thought of the fact that maybe I was actually just forgetting where I was.
Okay. Well, I think there's some things that we can do. Have you had any history of anybody in your family with like dementia or like Parkinson's type disease or anything of that nature?
My grandfather had Alzheimer's. Do I have Alzheimer's? I don't have Alzheimer's. Do I have Alzheimer's?
No, I'm not in a position to really say anything. What I'm trying to do is gain some knowledge here and maybe get you some further evaluation. So I don't want to jump to conclusions. Okay, I don't want you to think that you got Alzheimer's or dementia, but we just need to try to get to the bottom of this and figure out exactly why it is. It could be just that maybe you have your nutrition values are off kilter a little bit. Maybe you are dehydrated. Maybe you're not eating enough calories, and maybe that's the case. But tell me a little bit about kind of what what your sleep patterns are, things like that.
I feel like my sleep's okay, but I don't really know. I don't feel like I wake up and like think about it. I feel like I have a hard time. I feel like I get distracted really easily, but I think I'm sleeping okay.
Do you live with someone?
I live with my sister.
Okay. And has she ever indicated that maybe you're forgetful, or what does she say? Does she have anything to add?
I think she thinks I'm really forgetful, but I always thought she was just being mean. But
Okay.
I mean, I guess if she always locked myself out of the house. I forget my keys a lot. Is that normal?
Um,
Like at least 3 times a week.
really? Do you have any kinds of things that you know for sure? Like, do you forget sometimes where you're at? Do you get out into the community and forget how to get home, or how you got to where you are? Anything of that nature?
Now that you mention it, yeah, that's actually happened a lot.
Okay. And what do you do in that situation? Do you call somebody, or how do you work yourself out of that situation?
I think it just depends on where I'm at. Sometimes, like if I'm at a mall and I don't really know why I was there, then I'll just wander around until I find something that maybe I needed. But like if I'm at like someplace where I don't know, like then I usually call my sister.
Okay. And do you feel unsafe, or do you feel like, what do you feel during those episodes?
Just I'm really confused. I don't really remember why I was there.
Okay.
It scares me.
Let me ask you some questions. And again, all this will be confidential, so I want you to be open with me on some of these questions, because they're hard questions, and I want to know so we can maybe, again, try to direct our line of treatment here, okay?
Okay.
What about like substance abuse, alcohol, maybe some illegal drugs, tobacco, anything along those lines?
I don't do any of that. I have to keep up at the CrossFit gym.
Okay, so pretty much just working out and those types of things is
Yeah.
what you do.
Basically, yeah. I don't really have anything else that goes on in my daily life. Like I live and breathe the gym.
Okay, well, why don't we? Is it gonna upset you too much to pull you from the gym for just a little bit, maybe until we can get? It's purely for your safety, and what I would like to do is maybe pull you back a little bit from what you're doing, and then we can try to get a referral, get you into the referral system here, and then maybe have you see a physician before your condition worsens. I'd hate for you to hurt yourself physically as well. So what would you think about that?
If you think that this is actually a problem and I needed to get it checked out, then I would do it. I would be okay with that because I am actually legitimately worried now that you've pointed some stuff out that's been happening.
Well, that's what I would like you to do. I also would like for you to maybe mention something to your sister. And do do you feel comfortable having those conversations with her?
Yeah, we're really close.
What's that?
We're really close, so yeah.
Okay. All right. Well, let's see if we can get her on board. And also, what I would like for you to do, I don't really want you to be driving around. Get her to take you to and from places right now. What do you do other than CrossFit? Do you work?
I work at home, so it's not an issue.
Okay. And what do you do at home? What kind of work?
Just computer work for a insurance company.
Okay. And you do okay there? Do you forget some of your things that you're supposed to do, or have you been told that you've been,
I haven't noticed anything yet, but I'll start watching out for it.
Okay. Well, also, what I'd like for you to do is maybe, again, get your sister involved. If we need to maybe pull in your supervisor at work, I think that would be okay too, to let them know, as long as you're comfortable with that.
Okay.
And that way we can kind of attack this from all different sides. But that would be my plan. My plan would be, one, that stop the CrossFit for now. I'm talking just for a few days until we can get you in to see a physician.
All right.
I want you to try to make sure that you're drinking plenty of fluids and that you're eating right.
Okay.
So if that means that you and your sister prepare some meals together, I would like for you to do that. And then that's also, I don't want you driving right now until we can be sure that you're going to be safe.
All right. I can do that.
Okay. What I'm going to do, before you leave, is I'm going to get you a referral. I'll get you my business card, and then that way you have my numbers, and then we'll go from there, okay?
Sounds like a good plan. Thank you a lot for your opinion. I really appreciate it.
You're quite welcome. I'm glad you came in.
Me too.